English Week, Mobile Medical Care Clinic, Laura Niño, Laura Rodríguez, David Incapié, Sebastián Salinas. Introduction. The Mobile Health Care Clinic for Remote Areas is a crucial initiative that seeks to address the problem of lack of access to health service in remote and difficult to reach communities. Aims to improve the quality of life of people living in these areas and reduce territorial inequality in access to health service. Problematic. The problem addressed by the initiative of the Mobile Health Care Clinic for remote areas is the lack of access to health service in these areas. This can have a significant impact on the health and well-being of the people who live there, since they may not receive the medical care needed to prevent or treat disease. Objectives: enhance quality of life for people living in remote areas, reduce territorial inequality in healthcare, provide preventive health care and health education to target community, promote early disease detection and timely care, improved healthcare access for remote communities. Service offer. The healthcare service that will be offered through the mobile clinic may include general medical check-ups, preventive health exams, primary care, vaccinations, health education, among others.
The target community is one living in remote areas who currently do not have access to quality health services. This can include people living in rural or geographically difficult to reach areas who often have to travel long distances to receive basic medical care. The medical team that will be in charge of the mobile healthcare clinic for remote areas will be made up of highly trained professionals and with experience in primary health care, including general practitioners, nurses, and health technicians. Each of them will be equipped with the knowledge and tools necessary to provide quality, personalized medical care to each patient. In addition, the team will be selected for their commitment and passion for providing healthcare to communities facing barriers in accessing to health services. The financing funding for the mobile remote care clinic initiative can come from a variety of sources. These include government funds and donations from private companies. The government can provide funding through healthcare programs for remote or hard to reach areas, while private companies can contribute through sponsorships or donations. In addition, community funds can also be raised through fundraising activities and events to support the initiative. The combination of these funding sources can allow the initiative to be more sustainable and have a greater impact on the target community. In terms of transportations, the mobile clinic will have a vehicle especially equipped to provide medical care in remote areas. The vehicle will be a truck suitable for transporting medical equipment and supplies, as well as providing a comfortable space for patient care. The vehicle will also be equipped with medical technology and tools to provide quality care. Ensure that the vehicle is in good condition and regular maintenance is carried out to ensure their safety and effectiveness in the provision of healthcare services.
Okay, my name is David Incapié and I am to talk about technology. Mm, We We're going to use telemedicine and portable device will be used to improve healthcare services in remote areas. This will allow patients to receive medical care from specialists through video conferencing, and portable devices will be used to capture health data. Okay, the social impact. First, the social impact improve access to healthcare in remote areas, so this is so good for the people. The second, this project reduced healthcare disparities between urban and rural areas because in the urban areas is better than the rural areas in the aspect of health. Okay, three, decreased burden of preventable diseases, and four, improve health and well-being of the target community. Talking about the economic benefits, first, is good because reduce long-term healthcare costs, and second, this project is employment creation and will be generate different employers for the people, and this is benefits for the community, talking about economic and financial things. Three, positive images and reputation for sponsoring organization. For reduced travel and lowering costs for patients. And this is so good because it's important that in the rural areas um, make make different projects to help the people. Five, improve productivity in remote areas. And implementation plan. In the implementation plan, the first thing that we wanted to do is identify community and healthcare needs, then select and train medical team. Um, the three is acquire an equipped vehicle, then establish partnerships with local organizations, and implement telemedicine and portable services, establish medical information system, then implement transportation service for the people, and finally evaluate performance and effectiveness of the project.
Monitoring and evaluation. Number of patients attended. This indicator can be used to measure the scope of the initiative and the number of people who benefit from it. Number of visits to the mobile clinic. This indicator can help to assess the effectiveness of the initiative and the ability of the clinic to reach the most remote communications. Percentage of satisfied patients. Patients may be surveyed to measure their level of satisfaction with mobile clinic service and determine if they are meeting their needs. Percentage reduction in disease and health problems. This indicator can be used to ask whether the initiative is managing to improve the health and well-being of the community. To measure, to measure these indicators, monitoring and evaluation tools such as surveys and patient registries can be used. Data can be tracked over time to assess progress and make adjustments to the initiative if necessary. Challenges and solutions. During the implementations of the mobile health care clinic for remote areas, Several challenges may arise, such as problem of access to certain communities, difficulties in recruiting qualified medical personnel, failure of the equipment or vehicle used for the mobile clinic, and the need to adapt to different environments and cultures. To overcome these challenge solutions can be applied through establishing strategies, alliances with local organizations, and community leaders to reach the most remote areas, offering competitive salaries and benefits to attract and retain the most qualified medical professionals, maintaining and regular repair on mobile clinic equipment and vehicle and implementation of a culturally sensitive approach to accommodate the needs and preferences of the target community. And conclusions. In conclusion, the mobile health current clinic for remote areas is an initiative that seeks to address the problem of to lack of access to health service in this area and provide the quality of life of the people who live there through the provision of medical service vaccinations and health education. It is expected to achieve a significant social impact, especially in the most vulnerable communities. In addition, the initiative is expected to have economic benefits for the community and for the company or organization that carry it out. It is important to monitor and evaluate the success of the initiative, be measuring specific indicators, and to be prepared to face challenges that may arise during its implementation, be supporting and promoting the mobile health curriculums for remote areas. You can contribute to improving the health and well-being of people in this area and reduce territorial inequality in access to health service. Thank you.